Welcome to another episode of Boom and Bust. I'm your host, Tony Clement. I am here at the News Forum where all voices matter. Concerns about our crumbling healthcare infrastructure is nothing new, but our guest has data on how Canada compares and what we can learn. Please welcome back to the program Bacchus Barua. He is the Director of Health Policy Studies at the Fraser Institute think tank. Welcome to the program.
Thank you for having me on.
Bacchus, first, how bad is Canada's healthcare system?
I think unfortunately, if most Canadians look around them and interact with healthcare system, they know that something's wrong. Something's really starting to give. And this is a warning that we've been ringing the bell for a really, really very long time. I think one of the best ways to think about performance is by comparing Canada to other countries with universal healthcare. And that's exactly what we do every year. We just released a brand new study yesterday. And unfortunately, it told the same story. And that's that when we compare ourselves to 30 other countries with universal healthcare. So we're not talking about whether or not a country should have universal healthcare, but
Right.
under that umbrella, we still find that Canada ranks amongst the highest spenders, but we do very, very poorly when it comes to the availability of resources and particularly the timeliness of care. And we have a bit of a mixed record in terms of utilization and clinical performance. If I had to put it in one way, I would just say that there is a deep imbalance between how much we spend or put into the system and the value we get in return for that spending.
And that really translates into poorer outcomes than should be expected, right?
It can as well. We look at outcomes as one part of the entire equation. When we think about spending, I'll just give you a little bit of data over here. So Canada ranks as the fourth highest spender in terms of spending as a percentage of GDP after we make adjustments for age and so on and so forth. And it ranks ninth highest in terms of spending per capita. So whichever way you look at it, we're amongst the top third spenders amongst these 30 countries. But when we look at what we get in return for it, we're right at the bottom of the barrel when it comes to things like doctors per capita. We rank 28th out of 30 for that. When it comes to beds, we rank 25th out of 30 for that. Nurses, we're about average 13th out of 30. And then very, very low, we get things like MRIs and CT scanners at 27th and 28th. And when we understand what's going on here with this relative lack of resources, suddenly the stories that we hear about folks having difficulties getting into hospitals, getting physicians, hospitals running out of beds, using hallway medicine, all that starts to make sense. When we think about things like MRIs and CT scanners and the low ratios that we have, it starts to give us an idea. Okay, well, these are key diagnostic tools that are used in order to triage patients and help figure out whether something is urgent or can wait a little bit, and so on and so forth. But if we have so few of them, and we start to have the long wait times, which we can talk about as well, then again, those stories start to make sense. And absolutely, when it comes to outcomes, I would say that what Canada's system is probably trying to do is it's trying to do the best it can
Right.
with the wonderful doctors and the nurses and everybody who's working there. They're trying to do the best they can with the resources that we and we do triage patients. I would say in the early 2010s to 2015, we actually had some of the best cancer survival rate at that time. And that's
Mm.
because, with everything that was happening, we were trying to prioritize these patients. But what happens in the process is everybody else gets left behind. So
Right.
when we look at things like, the wait times for hips and knees and so on and so forth, which you might say, well, it's less important than cancer survival rate, but those are still patients who may not be able to work properly, who may not be able to spend time with their family, who may be losing productivity. When you have situations where something that might have been a treatable small issue, if you wait for a year or 2 years, it becomes a debilitating condition. And there are many recorded stories of this. And absolutely, our performance, and I want to make sure that I'm not skirting the issue because you asked
Right.
was very particularly about outcomes. It's a little bit all over the place. So the
Mm.
cancer care data has not been updated for 10 years, which is unfortunate. And I'm frankly concerned about what the newer data would say. But on other indicators, we always have situations where Canada was, let's say, average when it comes to things um, like uh, mortality rate after an ischemic stroke or something like that. And then we had very poor outcomes when it came to things like obstetric trauma. So it really was a mixed bag story. And like I said, I think the wonderful people in our system are trying to do the best they can, but
Sure.
our system is not supporting them in that objective.
Yeah, no, and I think that's the important point. We're not casting shade on healthcare workers, but if the system isn't working properly, then everybody suffers. Bacchus, we're going to take a brief break. We'll be back at you after these messages.